You are watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. Get a fixed set of teeth in just a few appointments. According to my first guest, you don't have to have dentures anymore. With as little as 2 implants, your whole life can be changed. With us, we have an expert on the topic, Dr. Balle. Dr. Balle, welcome to the program.
Thanks for having me, Randy.
All right, now, and we're going to talk a lot about implants today, and I know you brought photos.
I did.
But for people that don't know you, tell me about your practice. I mean, who's the typical patient that you see?
Well, the typical patient we have is grandmother, grandfather, mother, father, kids. We have a general practice, so we treat everything.
Like fillings, I mean, you do everything.
Everything. Fillings, we do crowns, we do veneers, we do TMJ problems, which are bite problems. We do implants. We do implants to secure dentures. We do implants to replace all the teeth in the mouth. So we do just about everything that you can do in dentistry. Partial dentures sometimes we have to do. We do dentures. We do everything.
How long have you been in Las Vegas?
22 years I've been practicing in Las Vegas.
So you're also, I guess, a professor or teacher at UNLV.
I am. I teach young dentists that are starting out, and it's a real joy teaching them because we teach them everything from fillings to crowns to dental implants to dentures. I mean, there's every part of dentistry is taught to them.
Now, I'm trying not to side with you on the show, and our program airs throughout the U.S., and I've interviewed dentists all over the world, but I think if people look at this, that these are dental implants, but this is a very cosmetic twist. That means these don't look like dental implants.
Well, nobody wants implants, Randy. They want teeth. They want to look like teeth. They want to look natural. They want to look like nobody knows they have anything artificial. So the idea is to give the illusion that they're back to normal. And that's what we're trying to achieve.
You do this procedure. Not a lot of guys do this, but you, in your practice, you do a lot of all-on-4. That means 4 implants to give somebody a fixed set of teeth in their mouth.
That is correct.
Permanent teeth.
Yes, it's a permanent teeth. It's teeth that they can eat their own food, that they were used to eating in the past, that they generally weren't able to eat when they had lost their teeth. So the all-on-4 is a process where they get 4 implants to secure their teeth so that they can go back to a normal life and be confident in their smile, be able to chew, and be back to normal, really. That's what it does for them.
Now tell me a little bit about your background training. I guess your father was a surgeon?
He's a general surgeon in Las Vegas.
How'd you get involved in dentistry, by the way? You don't look like a dentist.
No?
I always say that to dentists, but you really don't look like a dentist to me.
Well, you know, the truth is that when I was a kid, I had an injury as a teenager, knocked out a front tooth, and it was a traumatic experience for me. And, you know, people thought I was always angry because I didn't smile.
Okay.
And I didn't smile because I didn't want people to see I was missing a front tooth, and that was kind of tough. So I went through a lot of dental treatment, my orthodontist, my general dentist, and I was intrigued. They influenced me, and I thought, what a great position to be in to really help people.
You told me on the phone in high school you wanted to be a dentist. Is that right? I mean, you knew?
I did. I knew I wanted to be a dentist in high school. I was intrigued. I thought, you know, I always liked medicine, but I thought dentistry, boy, it's really very mechanical. I could really fix things. And, you know, it turns out that being the smile is such an important part of someone that it has such an impact on someone's life.
That doesn't surprise me. A dentist comes on my show and says the smile is important. How important is it as you see it?
Well, you don't even have to ask a dentist. You go in any walk of life. If people think you're not smiling, they think you're unhappy. So, I mean, smile is extremely important. It makes it a big impact. And people judge you based first on the smile and secondarily on the eyes. So it's an important part of you.
In this, and by the way, the word on the street now, I mean, dental implants are now accepted, they're mainstream. I mean, more and more denture wearers are doing this. Is that right?
Yes, it's probably the most successful procedure you can have done is dental implants.
Are there still, I mean, in Las Vegas, let's say, I mean, would you say there's 1,000 people with upper and lower dentures, tens of thousands?
You know, I'm not sure the exact population. There's 2 million people at least in Las Vegas, so I'm sure there's thousands and thousands of people without implants. Without implants, and they're suffering with dentures and teeth that fall out of their mouth sometimes. It could be very embarrassing.
Why aren't they all doing it, by the way? Okay, so if it's true that this all-on-4 procedure, if you're just tuning in, we're here with Dr. Balle, we're talking about no more dentures, get a permanent set of teeth or a fixed set of teeth with just 4 implants, or as little as 4 implants. But if it's so good, and if there's thousands of dental implant patients, what's your take on why they're not all doing it?
The truth is, the saddest part of this is that people are told they're not candidates, or they believe that they can't afford it. Those are the real reasons why they don't have it, and they don't know that they can have it. A lot of them haven't been to the dentist in many years, and then
so nobody's telling them to do it.
Nobody's telling them to do it, and then there's people that do go to the dentist that their dentist tells them that they're not candidates.
Does that really happen? Like, what? You're too old. You don't have enough bone.
Absolutely.
I mean, you hear that.
I hear it. I hear it. It doesn't. I mean, very few people are not candidates. That's the real truth. And I mean, I have stories of people. You know, I had a UNLV professor that was had to lecture, and his parcel was falling out of his mouth. He had missing teeth. He was mortified that he was going to have to speak in front of his class, and his teeth were going to fall out. So he came to me for a second opinion after going to his dentist, who told him he wasn't a candidate, and his dentist sent him to the oral surgeon and told him he wasn't a candidate. I said, you know, I believe you do. Let's work together. Let's see what you have. Let's do the CT scan. Let's see what you have as far as the volume of your bone. And I said, in today's day and age, with the way that we can fine tune and fit the implants in, you don't need as much bone. You don't need the grafting.
What about a 70-year-old though? 75-year-old, and that's young today, but still candidates. I mean, they've been in dentures 30 years.
Absolutely. I have a 79-year-old lady that came to me the other day, and she's been wearing dentures for 20 years.
Okay.
20 years with dentures. She's always complaining of sore gums, uncomfortable, and she's going to celebrate her 90th birthday. We're doing implants on her.
Now, you said celebrating her 90th birthday, you said she was 79.
I'm sorry, 89 years
89,
old.
okay.
89 years old. She's going to celebrate her 90th birthday. For 20 years, she's been with dentures. She's never really been happy. Her gums are always sore. She's always complaining of being uncomfortable.
But why do they do it? I mean, how do they even hear about it, by the way?
You know, the funny thing is I suggested it. I said, have you ever thought about getting dental implants?
Because you were doing her dentures, or you were taking care of...
I take care of dentures. I take care of general population of people that have dentures, and they just don't know about it. That's really the truth. They don't know that they can have it. And when they find out that they can have it and they can actually afford it, they do it.
But it sounds so painful, by the way.
That's funny, because these people that you say maybe feel that it's painful, they've been through root canals, they've had teeth extracted, they've worn dentures and tried to chew with their gums. Very uncomfortable.
But this 89-year-old, I mean, pain is not something she says, oh my goodness.
Actually, she's in pain now with her gums, having to chew with dentures, rubbing against her gums. It's like having, it's just a horrible experience. She can't eat the things she likes. She's uncomfortable.
Oh, so she hasn't had
time.
treatment yet?
No.
Oh, she's about to have treatment.
She's about to have treatment.
Do you get excited, by the way, when somebody says they've been 20 years in a denture? What happens? So when it's all done and they have these things locked in their mouth, like a regular set of teeth, what do they say?
You know,
like, what do you typically hear?
I'm so glad I did it. What a change of my life. I have freedom. Well, that's one of the words I use. I feel free. I feel I don't have to worry about this anymore. And that's huge. That's a huge part of it. A lot of these people will stay in their house. They won't go out to eat.
Really?
Could you imagine not being able to go out to eat with your family and friends because you're embarrassed or you're uncomfortable with your teeth, or food's going to get stuck and it's going to hurt you? And I mean, that's big. That's what do people like to do? They like to go out to eat. They like to socialize, and not having that opportunity is just. I mean, taking that away from someone is just terrible. I mean, it's a change of life, and that's really what it does.
Okay.
So
now,
it's more than teeth.
Your training in regard to implant. I mean, you've been doing this quite some time. Tell me a little bit about your training.
My training is.
Because I called you an expert at the beginning.
Yeah, I trained at the Coyce Center. That's one of the big things. I went to Terry Tanaka in USC. Did his study club. Very well known. These are renowned instructors in dentistry in the world. Pete Dawson, learned a lot from him. This is my training, and my training is basically it's dentistry. It's cosmetic dentistry. But you know, you have to attach these teeth to something when they don't have teeth, and implants are what we use. What a great instrument to attach to. It doesn't get decay, which is why people lose their teeth, cavities, breakdown, structural breakdown. They don't have disease in the gum and bone that usually attaches itself to the teeth. It's to titanium. So these implants have been lasting 40, 50 years for some people. It's tremendous.
In all areas of dentistry, and we talked on the phone, you think this is the happiest group of patients? I mean, the denture wearer that now, no more dentures?
Well, you know, the truth is, it is. I mean, they're definitely the happiest. I mean, no one really walks away from a dental office and says, wow, what a great root canal I had. I mean, that's just not something that they're really bragging about. But when they can come out and smile and have the freedom to eat, chew, and feel like everyone else, or like they once did, it's tremendous.
I've heard guys say that you get gifts, or you'll get a card from patients.
Yeah, we do all the time. I mean,
or a hug.
You know, that's the best part. It's not so much the gift, the hug, the emotion, the happiness that we experience with people. It's great.
So changing people's lives. You believe that?
I mean, that's the best value of what we do. Yes. So let me show you a case, and I can give you an example of what we have here.
Oh my goodness.
This patient comes in. The wife brought him in because she couldn't stand his breath anymore. His breath was absolutely awful. The reason he had bad breath was because his teeth were infected, his gums were infected.
So under the gum line, so I get this straight, like gum disease.
Yes.
That's has an odor. to it?
Oh, it's a very bad odor, very distinctive odor, very offensive, and people kind of reel back when they smell it. I mean, it's very, and it's. I mean, it basically just keeps you away from other people. I mean, it's that bad. And he's a diabetic, which it actually, exacerbates the problem. It's worse. Okay. So the wife is just complaining about the bad breath. She's saying the grandkids won't go near him.
Really? Interesting.
His teeth are actually green. I mean, they literally look green. They're just so infected. And they want something. They want to do something. They want to.
He probably never smiles, obviously. He doesn't like those teeth.
No, I'm sure he's covering up. I'm sure he's reeling back from his grandkids who want to talk to him, but they are even mentioning it. And they're saying, Grandpa, why do you have green teeth? I mean, how bad is that? So here were his options. He didn't really want dentures because when you don't have teeth, what else can you do? You can only give him dentures or no teeth. So dentures is a solution if you don't have any teeth. But he wanted something he could chew with, be confident with, smile with, and be back to what he was. And basically, that is putting dental implants to secure his dentures.
So what did you do for him? How many implants?
In this case, we did 8 implants. We did 4 on top, 4 on the bottom, and attached the teeth to the implant so that they didn't come in and out.
So he has a full set of teeth, upper and lower.
Yeah, this is the all-on-4. This is what people know it as an all-on-4. Basically, it's 4 implants, and the tabletop is the teeth, and it's secured by the 4.
And they're fixed. They don't come in and out.
They don't come in and out. They don't come in and out, and that's what's impressive. And so the after, just to show you.
Very nice.
You can see what a difference is.
Looks like a young smile, by the way. That's why I'm laughing. Huge difference in the before and after.
Huge difference. I mean, look at the way he looks. I mean, could you imagine the difference of going out in public? You're never going to smile with this smile. With this one, of course you are. And
so his breath freshens up immediately.
Absolutely.
So when you extract the teeth, what?
You take away the infection. The infection's removed. I mean, that's basically.
What if somebody says, my gums are too bad to get dental implants? Do you ever hear that?
Well, yeah, all the time.
Okay.
I mean, all the time. But the gums are too bad because the teeth are causing the infection. So getting rid of the infected teeth, then you can make the bone healthy and put the teeth. Absolutely, you can get the gums healthy again.
Interesting.
Yeah.
So what does he say when it's all done? This particular guy. Can you remember?
He just, he wasn't a very emotional guy. I mean, it was he was trained to be that way, especially because he couldn't smile. He kept his lips tight so that you wouldn't see his teeth. But definitely smiling, very happy, very confident. And we gave him a smile that basically looks natural. We didn't try to make him Hollywood. It's something that if someone sees him, you don't know it's dentures.
All on 4. Okay, people just tuning in. We're talking about no more dentures. Get a permanent set of teeth, a fixed set of teeth, in just a few appointments. And obviously they have to come in to find out if they're a candidate. But this guy right here, okay, so 4 implants, a full arch of teeth. What could they eat?
All the foods that you would naturally eat. Apples, steak, everything. I mean, there's really not any restrictions.
Have you ever had patients tell you, by the way, this is what I'm eating? Do they ever brag about what they're eating?
Oh, sometimes too early, because the problem is they're so comfortable with them. They're not supposed to eat with them right away anything really hard, because the bone has to actually attach itself well to the implants. So they just start eating right away, and we have to kind of hold them back a little bit because we need everything to heal properly before they really can get into it. But in a few months, they're back to eating everything.
But they can eat regular food.
They can eat anything. They can cut with no, they can eat better foods than they were eating with their denture. They can eat things because the denture is now not on the gums. It's supported by teeth.
But they're never without teeth during this process.
No one ever goes without teeth in my practice. I would never humiliate someone like that. We wouldn't want that to be that way.
What are the misconceptions? Denture wearers come in and they hear about this procedure, 4 implants getting a fit. What do they want to know? I mean, what are the questions? What does it sound like? What do they always ask you?
Well, they want to know if they're a candidate. That's the number one thing. Will I go without my teeth? I mean, that's huge.
So am I too old? They want to know those kind of things.
Right. I mean, we have patients that come in with infected teeth, like the patient I just showed you, that are going to lose their teeth. They're the most traumatized because they haven't even experienced dentures. They just fear it, and rightly so, because it's a horrible experience. So by having those patients they want to be confident that they're never going to go without teeth, that they're not going to look abnormal, that they're going to be able to function in their lives while they go through this process. And then we have other patients that have been missing teeth for so many years that have the opportunity to get teeth attached to their jaw, and they go forward with it, and it's a life-changing freedom for them.
Isn't it true a low-priced option, 2 implants? Is that true? Denture wearer watching this, 2 implants. Snap in, snap out, much better than a regular denture.
It's a dramatic difference. I mean, I have many patients that, we have to work within their budget. We have to be realistic. I mean, if I could do all on 4 for everybody, I would.
But is it that much better, just 2 implants, than a denture?
I'd say 100% better, 100%
Okay.
better, because I mean it's confidence, it's freedom, that they're not falling out. And for many people, they don't have enough jawbone to hold those teeth down. So just 2 actually anchors them, and it's very affordable, like anything else in life. I mean, it's definitely doable.
So, we talked on the phone that somebody could get the procedure, you give them a medication, and then maybe even the next day they could use, I guess, whatever you're using, Advil or over-the-counter stuff you're saying.
That's correct.
For pain.
Oh yeah, I mean, we give them, they can have a narcotic if they need it, but generally most people, I'd say just about 99% will say to me, I didn't have much pain at all. I didn't have to take anything.
Well, what's
so that's
going on?
impressive.
I mean, help me understand. Why
Yeah.
is it what used to take you guys a year or 9 months, now you guys can do in just a few visits?
Well,
What specifically has changed?
We're able to see the bone better. We have 3-dimensional imaging. It's called CT scans, where before we had a flat X-ray that we would look at and estimate the amount of bone. So we're not guessing as much anymore. We can locate the bone with this image. We can angle the implant so we engage more bone, where before they were told they didn't have enough bone, they have it. And as I mentioned to you earlier, a lot of these people feel like they're not candidates, and that's like the worst misconception.
They're too old.
Well, not candidates, and then there's the ones that say that they're too old. And I know
Not enough bone.
Yeah, not enough bone. And
What if
some
you
of
have
them,
osteoporosis? I mean, if you're 77, whatever, I mean, you probably have a little osteoporosis. Can they still do it?
the jaws are the hardest bone in the body. They're harder than the hip bones and the bones that really suffer from osteoporosis. So yeah, it can be done. We do it all the time.
And pain is not something they should be afraid of.
Not at all. I mean, most people do not suffer from much pain when they have this. I mean, there are occasions, but very rare. It's not so common. So most of them are very happy they went through it. They've been through a lot more pain with teeth decay, root canals, extractions, and wearing dentures on gums that are absolutely sore or dry.
Now, you say of the thousands of people in Las Vegas that have an upper lower denture, if they knew how good this was, you couldn't fit them in on your calendar at the office.
I would think so.
I mean, you believe that?
I do, absolutely. I think a lot of people just don't know that this is available to them. And a lot of them are told they're not candidates, and that's the sad part.
Okay, okay, good.
Yeah.
So you brought photos. What are we looking at here?
Well, let me show you this lady. She's in mid-50s, just teeth that are just breaking down. She had severe asthma, had to take a lot of inhalers, not the normal environment for healthy teeth, and a lot of them were breaking down, chipping. She'd been through, as you can see, she's had crowns and metal margins, metal teeth around, and it just looks terrible. And she wanted to improve her smile, and she wanted to be able to depend on her teeth when she chewed, because they were just breaking down. Dentistry, crown,
So
bridge
she was
after
headed
bridge.
for dentures, this woman.
She was headed for dentures, absolutely.
Okay.
Yeah, and she was losing her teeth because they were just, the structure underneath was just not holding up anymore.
Is that common, by the way? I mean, because it doesn't look so common. I mean, I don't see that.
Well, people don't show it to you. They hide it. They keep their lips around it, and they don't smile. They keep it themselves. So yeah, you wouldn't know it, but it's very common. See it all the time.
So for her, what'd you do?
So for her, we basically kept the healthy teeth, the few in the front, and in the back, we replaced them with dental implants. So let me just show you her after. Actually, let me show you before her picture of her full face and what a dramatic impression it makes before. This is what she had to deal with. And she actually had a plastic tooth that came in and out. Absolutely, very uncomfortable. Of course not. She's an executive, just didn't want to have to deal with that. But look at the after, Randy. Look at her face and look at the appearance in her eyes. Look at the smile. Look at the youthfulness that she's regained. Side by side.
It almost looks like it could be her daughter. I mean, no kidding.
Really? Yeah. Well, I'm sure she feels a lot younger, and I'm sure she feels a lot better. This lady actually travels from California to see me, and she travels a long way, and she's absolutely thrilled about her results. She's amazed.
So
and
dental
she
implants,
feels so confident.
And they don't come in and out?
They don't come in and out, no. They're fixed in place.
Now, do these people, now you say she's an executive. She looks like an executive now in the after. But do they say, I should have done this years ago?
Yeah, they do. They say that all the time. The thing is she had a dentist. He'd been fixing one thing after another. And at a certain point, they start losing their teeth, and he starts replacing it with partial dentures. Now, partial dentures are dentures that are part dentures, and they connect to the other teeth. Well, the teeth are already weakened. So now you're asking to borrow strength. Those tend to break off. And the bottom line is they have an artificial thing in their mouth that they have to learn to chew with and function with. Very uncomfortable. And here's the worst part of it. They lose bone over time. The best thing about dental implants today is that you know, when you lose your teeth, your bone goes away. There's no getting
You start
around
looking
it.
older.
You start looking
Sinking
older.
in.
You lose your facial appearance. Your bone sinks in. You're not just losing your teeth. You're losing the gum and bone that supports the face, and you lose your facial expressions.
So
you
in
maybe
this
get
economy,
older.
okay, I mean, obviously, there's a credibility in the before and after here. Are you finding that people, because they're working longer, living longer, are investing in their smile? I mean, do you see a lot of that?
Many do. You know, in this economy, you'd be surprised. I mean, trying to get a position or a job, it's very competitive. You have to look your absolute best. And what do people judge you on? Your smile. That's one of the main things they do. And if you look good and you're confident about how you feel, you're going to get a job over the person that's not confident. So I think that's a huge part of it in this economy.
So what else do you have?
Okay, Randy, look at this. Look at this guy. I mean, he
Oh, my
lost
goodness.
all his teeth. Actually, he knocked out his teeth playing hockey. I mean, that's what he had. And he had bridges, and he decided that, you know, his teeth were bad. Someone else took out all his teeth and put them in dentures. Poor guy.
Young guy, by the way. Looks
Yeah,
like a
in his
young guy.
40s. I mean, young guy, early 40s.
So there are 40-year-olds in dentures?
40 years old.
That's way too young.
Yeah, it's way too young. But so is 70. Nobody should be in dentures. I mean,
Okay.
you know, there are people. I mean, there's no reason in this day and age that people should have to wear not have teeth.
standard
Not
denture.
have teeth. Not have teeth. Because when you have dentures, you don't have teeth. I mean, you
Okay.
have pieces of plastic in your mouth that you're trying to live with. I still to this day, I don't know how they manage, but they do when they can. But they're just a.
So his after, what'd you do for him? What'd you do for this guy?
For him, I basically, well, he went with a denture for a year, could not wear it, gagging, choking, he would not wear it.
On
He
the
went
upper-
without
on the upper.
and lower, would not wear his teeth. So he was just mortified, couldn't get around in town. He's a plumber. I mean, he's an average guy. Went out and he basically was going around. When he'd go to the bank, he'd have his teeth in his pocket, put them in, so that
Really?
he at least could smile when he'd go somewhere, and then take them out when he'd come back out, because he just couldn't handle holding them in his mouth. They were gagging him. We have a lot of people that just can't handle having dentures, and gaggers are one of them. So what we did is we did the all-on-4 procedure.
He looks good. He looks good.
Oh, tremendous.
So it's like he gets his teeth back in a way. I mean, this guy.
Absolutely
Look at the
gets
difference
his
with
teeth
this
back.
guy.
As a matter of fact, he has his. You know, the best part of it is he came to me about 3 years later, because I don't see them that often after they get them. They're so happy.
Yeah.
I got to get them back in just to make sure everything's working okay, just to clean them like you would, just to make sure. And he basically said, you know, I said, you have any regrets about this? He goes, not at all. He goes, the best part of it is I can crunch and eat the foods I used to eat that I couldn't eat with, you know, my gums, because he would eat without his teeth.
Now, this is a compliment to you, but when I look at these you know, this photo, especially this particular photo, you know, the teeth are like curved and the pointy canine. I mean, this does not look like a denture. I feel like I could spot a denture walking down the street.
Well, if you can spot a denture walking down the street, it is, you know, that's not done right. The idea is when you do teeth, you want them to look like nature, and we want to, you know, replicate nature, what he had naturally. We
So
use
the
photos.
dentist you go to plays a role in the prosthetic or whatever you're calling it, that fixed set of teeth they get?
The dentist plays a
Yeah.
role, absolutely. That's the main thing. You want to have someone who knows what someone should look like, and part of it is doing a little research, finding out what the person looked like. Bring some photos of what you did. There's no reason we can't make them look.
Did they
like
ever bring
should.
in photos of movie stars that they want to look
I
like?
have seen that. I have seen that. But
Or famous
that's a
people?
little bit tough because.
Did they ever bring in pictures of me, by the way?
Yeah, I
Say
haven't.
wanna
Not,
smile.
not
I'm
yet.
just
They
kidding.
haven't brought yours
Listen,
in
we are
yet.
out of time, so show me your last few photos.
Okay, let me
This
go
is good
through real
stuff.
quickly. This is where he started, just so you could see that. And you can see what a tremendous difference. This is a close-up. I mean, how can anyone call that a denture? I mean, you can't tell.
They have ridges, very nice.
You can't tell. It looks like nature. It looks like. Here's another one that was extremely dramatic. Young lady.
Oh my goodness.
I mean,
That's a
they're-
woman?
Young
Yeah,
lady, absolutely not. Her teeth were just destroyed from doing too many medications. She was sick, lost all her teeth. We ended up just replacing the upper and lower with snap-on type dentures. This is a woman. Look at the curves. Look at the femininity of the way the teeth are shaped. I mean, you can tell the difference between a male and a female just by the lips. I mean, we're not even looking at the full face. So you have to design that in the smile, and it has to be
Very
really
nice.
standing out.
Is there such thing as a happy denture wearer, by the way?
No, I don't believe there really is. I think they just get used to, they deal with it, but no, they're not
Okay.
happy. Let me show you just one
right,
more
all
case
right.
because it's very dramatic. It happened to be a young person, but this particular case, I mean,
Oh, my goodness.
this guy's on a date and one of his teeth falls out. He's got one of those plastic flippers in and out, and one of the teeth breaks off. His teeth are just decaying, just a disaster. Look at the dramatic change in his appearance. I mean,
Wow.
I mean, this is just
Wow.
life-changing for this guy. And we did this procedure, was an all-on-4. In one day, he left our office from what he
I mean,
had
side by
to that.
side. I mean, what a difference.
And
this guy.
And the amazing thing is this was done in a day. I mean,
Also,
there's a little
it's clean.
pre-planning.
I mean, this is white. It's clean. I mean, they look, sophisticated almost.
Sophisticated. They look natural. They look happy. It changes their lives. I mean, could you imagine being on a date and your tooth falls out? They're decaying. He's having to keep his lips.
Date. That's a bad date.
He's trying to keep his lips
How was your
together.
date? My tooth fell out.
Bad. That's what drove him to the office. I mean,
So the typical patient that comes in, and we're out of time for dental implants, no more dentures. Get a fixed set of teeth. He does the all-on-4 procedure, get a permanent set of teeth in just a few appointments. Is that right?
that's correct.
Says it doesn't have to hurt, right? They
That's
don't
right.
complain.
No pain.
About pain.
There can be some discomfort,
okay.
but let's be real. You're having a surgical procedure, but the funny thing is most people do not have much discomfort.
My father, I don't want to tell, I have to tell you the story, but my father, 77 years old, got dental implants, 2 on the bottom, snap in, snap out. He goes, Randy, here's my complaint. They didn't push or explain enough how it wasn't going to hurt. It's an absolute true story.
Is that right? Wow.
And
I mean, that's
and
real.
my production manager, because of our interviews, she got same thing, and she talked to me on the phone. She goes, Randy, it didn't hurt at all. I mean, this is what they're telling us. So good for you. What's the first move? Somebody watching this, denture wear.
Call my office. I know we can help you. I mean, and there's always a way we can help someone that's a denture wearer. There's if you're dissatisfied and you're unhappy with what you have, call me. Call Balle.
Is it mostly women that are doing this, by the way?
No, it's men,
Both
women,
mixed?
young, old. I mean, we have a case that was the lady was almost 100 years old. I think it's 99 that decided that was time to do it. I mean,
99 years old.
99 years old, wanted to have dental implants, did not want her dentures.
Have you done the case?
Yeah, it's been completed. 2 years ago we did it. Yeah,
Is that
amazing.
right?
99 years old.
Is it just, because they're older? I mean, they don't fall out, but it's just longer healing time for an older person?
No, the healing time's exactly the same.
Is that
Bone
right?
heals. Yeah, we haven't had, unless they're super unhealthy, it's very rare that someone can't have implants. And I can't stress enough, one of the most successful medical dental procedures that are available that works, dental implants. They have a 95% success rate, and then when it's very successful. And people have been not taking advantage of it enough, and that's the sad part, because they're told they're not candidates. They're told they're not.
Dr. Balle. See
That's
Dr.
correct.
Balle. No more dentures.
That's right.
Good for you. Thank you so much
Thank
for
you.
coming.
Thanks
Good
for
stuff,
having me.
by the way.
Appreciate it.
Great info. You've been watching the Wellness Hour, leader in medical news information. I'm Randy Alvarez. If you would like to see this interview again online, you go to YouTube, put in Dr. Balle or dental implants. You can go to our website at wellnesshour.com, put in Dr. Balle's name. You'll find him there. For now, I wish you good health.